Thank you very much, President.
A todo nuestro pueblo. Yo creo que usted ha dado cifras que
I think you have mentioned numbers that locate Cuba regarding the world.
es importante que no dejemos de ver
And it is
el
important
contexto internacional,
that
no indicadores, sino también alguna
we are linked to the international context, not only in the indicators but also in some experiences.
que está pasando en los
But as you said, the important is what's going on in the country
que enfrentamos.
and how we have to face it.
Yo creo que compartir algunos números con nosotros.
I want to share some numbers with our people
Está el país
that locate us in what kind of moment the country is, and of course some provinces. It will allow us to understand the responsibility we all have
de batalla que compromete la salud del pueblo.
in winning this battle.
Algunos números que creo que de manera general es importante
Some numbers that I think it is
que
important,
se dan cada mañana.
although we see it every morning.
La situación actual.
This gives us a context of the current situation. It is important.
86 días.
We've been 486 days in the country facing the pandemic.
486.
486 days.
Voy a hablar de datos de cierre de
And
semana que
I'll talk about data
de cómo lo avanza.
about these days.
Y en estos momentos se
And right now
la mayor intensidad
we have
transmisión de esta
more intensity of the spread of the disease.
comportamiento
We've seen a behavior in the increasing the disease, which has generated
con incremento
an overflow of the
utilización de la
health system
que inevitablemente
that
ha generado
unfortunately
funcionamiento
have generated some failures in some territories during the last stage
de casos que ha tenido.
because of the number of cases we've had.
Hasta el 10 de julio, que es la fecha en que cerró,
Until July the 10th,
ha diagnosticado
Cuba has diagnosed
400
491 cases.
de un número elevado.
Yesterday was another day of elevated cases, more than 6,000 cases confirmed yesterday,
Acumulado
and all those cases we have accumulated, distributed all over the country.
la mayor cantidad,
Most of the cases,
7,5%,
with 37% of the cases, have been concentrated in Havana.
90% de los
However, Havana had more than 50% of the cases in the country.
empezado a crecer el resto de la provincia. Matanza, con un 12,1%
Matanzas with
de los casos, y
12%
Santiago de Cuba,
of the cases, and Santiago de Cuba,
acumulando estos tres territorios,
accumulating these three territories 59%,
el total de los casos que han sido
59.4% of the cases confirmed in the national territory.
desde la primera semana de diciembre del 2020.
Since the first day of December 2020,
Una tendencia ascendente en el
we saw a growing rate in the diagnosis
tiende hasta la actualidad,
extended to the current day,
más
reaching the most elevated
territorio del país desde el inicio de la epidemia en Cuba.
spread level.
Ha habido un comportamiento
We have seen
aumento progresivo
an increasing behavior month after month. After you see at the graphs we show,
escalera
it is like a ladder
exponencial del número
of exponential growing of the number of cases,
de la intensidad de transmisión en el país,
with an increasing
36,5%
intensity in the country with 46.5%
anterior al cierre del
regarding the
diario de casos de
previous month,
687
with
y ya en el mes actual
an average of pretty much 1,000
casos diarios
daily cases.
lo que habla de la velocidad de transmisión.
This tells us more about the transmission speed of the disease.
Los casos importados se comportan
Imported cases
en promedio de 78.
are an average 78 per day,
Los casos autóctonos
and
de una
the predominancy is the autochthonous cases, which tells us more about the local transmission in the country.
en el mes de junio
In the month of June,
terminó con 50.622 casos
50,000
en los primeros días de
confirmed cases, and in the last day, in the
146.
first days of July, we have pretty much 50,000 cases, except
Una
Isla de la Juventud. The rest of the territory presents an important transmission,
de transmisión,
the highest levels of transmission
como se ha estado
in this month, as we have explained, are concentrated in Matanzas,
con
with
665 casos promedios al día, aunque
more than 1,000
de más de
daily cases as an average,
La Habana con 500,
Havana with
Camagüey con
500, Camagüey with 361, Santiago 263, Santi Espiritu 202, and Guantánamo 201, So these provinces concentrate 72% of the cases diagnosed in the country during July. Other 7 territories have had an average of more than 100 cases, Mayabeque, Holguín, Villa Clara. That tells us that no province escapes of the complex situation of the territory. So the last week, the average daily cases was more than 4,000. And the active cases, as the President was explaining, have been growing considerably, with 32,000, which is 50.8% the number of the previous week. The contagion data in the minors, which is something we have following very closely in the last months, practically are increased every day. It is not about criticizing the family, but we call on the responsibility of each member of the family. Before this reality that the country is living, sadly, we've had death of minors, even those milking. And in other cases, we've had some of these minors evolving to a critical stage. And we are certain that each family wants his children to be safe. And let's think about what can we do as a family to face and to preserve. Within the vaccination plan, kids are not included in the vaccination, what makes them a vulnerable group, which is not vaccinated. And that's why we see an increase of cases. Before this sad situation, we have an increase of the deceased. In the last weeks, the number has been growing, 82, 110, 186 in a week, going for an average of 16 deceased, to numbers that go from 12, 16, 27, which is regrettable for us, taking into consideration that it is always sad, the death of a person. The accumulated lethality is 0.64%. In this month, lethality is 0.53, 187 deceased, and growing in relation to the previous week. Please see that if the lethality is decreasing because of the number of cases, really the number of deceased hurts us, even when it is only one territory and when young people are dying, kids, even, and I say it again, it hurts every person that dies. The increase in the week is because of Matanzas. Matanzas has been growing in the number of deaths. Santa Espiritus and Villa Clara, also Ciego de Ávila and Pinal del Rio, Habana, Cienfuegos and Holguín. There is a group of issues that we have evaluated, we have to continue discussing in the country, and it is related with the elements we have failed in this plan. So the strains circulating generate more contagion. We have seen that's why the transmission of the disease. There's been lack of responsibility. There's also been failures in the detection. We have discussed this in all the territories. cases with symptoms of the disease, they've made us to lose opportunities or late arrival of the patients to the health systems. Also, violations of the health systems. So you see how many working centers generate events after violating what is established. On the other side, the real diminishing of the perception of risk of the population. And more than risk perception, we have insisted it is danger perception. Everyone is exposed. We have seen lack of discipline in recent days. We saw the cockfighting that generates an important transmission in the province. It actually complicates the province of Pinar del Rio. But we have another examples of community parties, family parties that have generated important events in the community. Also, the health personnel have not had any rest since the beginning of the pandemic. So that's why, and in the way the cases are growing, the health system gets worse to face this situation. We have seen the concentration in public places. Everyone has to actively participate, and also the lack of health intervention. On the other side, and this is an important element, is the new strains, internationally recognized as high contagion strains that increase the mortality rate, that, following the criteria of our experts, has impacted the transmission and the evolution of the disease. It is important that our people to know that the alpha strain and the beta strain, the South African and the United Kingdom strain, we have seen an increase in the transmission rate, the speed of transmission of this disease. And also the Delta strain, the one identified in India in June, which have increased the transmission speed superior to that one we had. International studios, international research published, and some media taking into reference some declarations suggest that this Delta strain is associated with a higher transmission, 68% compared to the Alpha, as most hospitalization and a less response to the antibodies. If I put this in a graph, the 614G, which dominated in the first stage of the epidemic in the country. On one side, at the beginning of this year, we saw the alpha strain and the beta strain. For each patient, we have 4 other infected people. And when I talk about the 64% for each diseased, there can be 6 contagions, and that's why we see when we have 1 sick people in the family, then only 1 person infects the entire family. We have families who have lost more than 1 member of the family, and that's why I say this, to understand the risk. And I say this that we all need to participate in the protection of the family, the protection in our working places. It is a silent disease with a percentage of people without symptoms that can be easily transmitted. Although This strain has been reported in several provinces. This is Matanzas with the highest rate of infection of this strain. Measures do not change. The growing of the transmission of these strains compels the health system to take measures to increase the services. Therefore, to avoid contagion is the best investment we can do in our country. It is of vital importance the participation of all, which is the only way that we will avoid people to get sick. The President was talking about this and some of the elements of the international order. These outbreaks of the Delta strain of the COVID-19 have grown in the countries that have a controlled situation. With a high vaccination rate. I'm talking about Israel, I'm talking about with high, and those countries have had a setback because of the transmission rate they've had, and other countries with a lower percentage of vaccination today, they are showing more contagion numbers and more deceased numbers in Cuba. We have applied more than 7 million vaccines to our population. This has allowed us to vaccinate 27% of the Cubans with at least one dose, 22.9 2 doses, and 16.7% with 3 doses. It is important to highlight that advancing in the vaccination does not stop the transmission of the disease. It is true that the people have less possibility to get sick or to die. In the health intervention, we have 5 municipalities. 25 municipalities which are now vaccinating, and there are 8 municipalities that will start this health intervention. As I explained before, practically all the provinces have presented an increase. And I will talk about the case of Matanzas, as it is a province with government teams, with health teams and other organisms. This is a province that today presents the more complex situation of the country. The average of daily cases and the high number of deaths. So in this territory we've been carried out some actions to and independently of the efforts we have carried out in this territory, not everything is solved, and we do not have all the capabilities of the capacities. We have seen failures in the attention system, that some positive patients today are in their homes without an adequate following up, elements that we have been working, and that I will explain some of the actions to diminish the gaps that we can have. Although I say Matanzas has a lethality rate not that high, but I say it again, only one death hurts us. None of them. We have adopted some decisions, and as we organize the institutions gain more in the quality and how we classify the cases. As in any country, we have tried to say the human resources. Of 362 polyclinics, we only have to cover 22, but we had 260 polyclinics that were not working because it's the medical resources we had are working in other hospitals. They have controlled the epidemic breaks, and their health professionals had to go to other centers to take care of the population. We've carried out a work to incorporate the health personnel who were not working. 248 doctors who were not working. 145 are working right now. 250 nurses. Now 240 are working right now. And we're trying to find a solution to the problems. It is a problem. It is a personal necessary to attend the people, and its absence creates problems to the work of their companions. And a visit of the President and Prime Minister to the territory, we put important examples, also what we saw there, of people. We have tried to find solutions with the government and also in the neighbors. We were talking about a marriage with a 3-year-old girl that they started to work, they tried to find a solution for the girl, and in another case, a neighbor, we had a 56-year-old person with a sick mother, and a neighbor took care of the mother. So there are many solutions that they have sought to continue with the battle in their territories, and we continue incorporating that force against the epidemic. On the other side, the recently graduated students, more than 300 students, they only like the graduation, and they joined the fight against the pandemic. That we have seen that in the entire country. And right now, we are counting on them that in the 6th year of career, they have been working to fight the epidemic, and it is fair to recognize the disposition of all the people. It's also just to recognize, and not only in Matanzas, but in the entire country, what the students of the medical sciences have been doing. It is, and I think when the history is written of everything we've had in the epidemic, we have to write about them, of what the university students have represented, especially those of the medical sciences. 235 students of Matanzas, all of them are incorporated in the activities in the campaign hospitals. Sometimes we talk that in Matanzas there are no campaign hospitals. In Matanzas, and we are improving all the process of attention so that network works as an institution of health, even when the comfort does not correspond to health institutions. So we've been working in the Abdala vaccine. Matanzas has 3 municipalities that finished the vaccination program this week: Matanzas, Cárdenas, y Colón, while the Zapata swamp are in processes of intervention. So it's been a priority because of the complex situation in Matanzas.
En fase de la intervención sanitaria y se le incorpora lo agarrado.
On the other side, we have been trying to look how the family doctors go to their places again. 112 isolation centers, a capacity of more than 6,000 beds. So we do have looked solutions to but I reiterate, this speed transmission is quite high. So there is a number of patients which is quite high. So we look variants to improve the situation this week. That's why we have to be 2 hotels will be ready that will work as hospitals, and we will have the Henry Reef Brigade working on them. They didn't take vacations, and after the quarantine they will work in these 2 hospitals with all the experience acquired internationally, and they will work in this institution. In the case of the health personnel that we have incorporated in these provinces, sometimes we talk about the international solidarity, and we do not see how much solidarity we have with the Cubans, and we cannot calculate how many people have reached the provinces of this position to send human resources to the other territories. Knowing about the complexity, we've had 205 doctors and more than 200 nurses coming from other places of the countries, which are working in hospitals. We have also incorporated specialists to guarantee the attention process, and we strengthen all the process with officials of the Ministry of Health. The province of Matanzas, and I talk about Matanzas because it is an example of what cannot happen in the sense of containing the transmission because of what it represents. That's why to work in the cause of stop the contagion chain is the element key. Y 1.054 están dedicadas a atención de pacientes COVID. Por lo tanto, esto cuando nos pasa también. So what all this happens, it also compromises the attention to other diseases. The number of beds to serious patients is 105, and we had an increase 50 beds in the last weeks, but we will increase even more. This process will allow us to have 105 more beds to attentions. In Cuba, we have 110 ICU beds that we are trying for them to be It is true, and one of the issues we were discussing in Matanzas, and the same happens in other hospitals. We have used we've used the halls of the hospitals. Well, that's the response capacity for a person who needs attention, won't be unprotected in a health institution. And that's a response of a certain time to guarantee the attention. And it is a situation that we will solve, as we will continue increasing the capacity. Because it is not like having the bed, it is a technological backup and the human resources needed. We have improved the attention protocols. Also, the President was talking on how we will improve the patients at home, because in the case of Matanzas, we had to change the diagnosis that in Cuba we are doing in the rest of the provinces by molecular biology, and to take it to the antigen test, because the laboratory capacity independently of having increased it from 1,700 to 2,500 in this province. Even the technology, it was not, we didn't have time enough to have a better diagnosis. We had people with 5 or 6 days without a confirmation of COVID-19 diagnosis. That's why we took that decision. It was proved a temporal decision until we could solve the situation. Until the situation allows us only to diagnose, to have the diagnosis with the PCR. We adjusted all the protocols of attention to the patients. I was talking about the number of kids. We opened new capabilities to for the kids. On Saturday we opened 150 new capacities for the kids, because we continue seek the way to protect all these people, the kids and the pregnant who are not vaccinated. So I was talking about the PCR capabilities, how I have increased all this, how we have used new technologies in the country that has allowed us to give new responses. And we have also looked how to improve the capacity that we can give in all the provinces, and especially in Matanzas, to stop delays in the consultations. When we went to the polyclinics, we saw lines of people to be tested, and we have increased the number of consultations at the polyclinics, and also the number of places where we can carry out the antigen tests. We have increased all that, but it was one of the elements the authorities of the provinces have worked on, trying to look at better quality of attention and to lower the insatisfaction of the population. We've also had a medicine deficit. We're trying to find the alternatives. In the midst of the blockade affects the health system, as the numbers say. We have not been able to buy ventilators, reactive, and we have to buy it in other places, more expensive. All this is a very complex situation. We're always trying to find solutions to guarantee the attention of our population. The future is not favorable. We will see more cases. The virus is very dangerous because of the high rate of disease we've had. But we can change that. We can change that behavior. If we continue vaccinating people, if we guarantee that distancing, and if we guarantee the compliance of the protocols. So, Alina, I think that I can sum up that the situation is complex, and it is necessary that our people to have conscious of that and to act. We ratify that our people that the health personnel we continue without rest. I think that example given in the difficult conditions during all these kinds of pandemic, working without rest, with commitment, with sensibility to defend, first place, the life of our people. And we need the support of each Cuban. It's almost 16 months of fight. The pandemic fatigue the President was talking about is a reality that we face somehow, but when we see the lights and the advance in the vaccination campaign, we have to be sure that our professionals will continue working. It is not an option. We do not have other option because indiscipline is paid in a very high cost, which is the loss of lives. So there is no other alternative to be protected and to work as a great family we are all.